Watch for chest rise. Give 2 breaths.
The most important thing with this part is
whenever you
this next section is going to be about the bag mask device.
Providing effective ventilation is critical to successful high-quality CPR, especially in respiratory-related emergencies such as drowning, anaphylaxis, and asthma. Guidelines recommend against excessive ventilation during CPR, and research suggests that some rescuers are less confident and less effective when using a bag mask device on their own without assistance. Because using a bag mask device is such an important skill and is common in the healthcare setting now, bag mask devices consist of a ventilation bag
Above the person's head. You'll use the EC clamp technique to hold the mask in place. To do this, apply the mask by first placing the cushion at the narrow mask onto the bridge of the person's nose. Then lower the mask fully onto the face, watching for the cushion to bulge as it initially seals against the face. Form a C with the thumb and index finger of one hand and press down on the dome of the mask toward the face to further seal the rim of the mask. The remaining 3 fingers of that same hand should form an E to reach past the edge of the mask along the bony rim
to achieve an airtight seal between the mask and the face, and squeeze the bag with your other.
Breaths are given with each breath given over 1 second after every set of 30 compressions. Be sure to deliver each breath over 1 second with just enough volume to make the chest rise. Delivering breaths in this way will reduce the chance of gastric inflation, or air going into the person's.
One rescuer focuses on keeping the airway open and securing the mask, while a second rescuer squeezes the bag to deliver breaths, just enough to cause a rise. The first rescuer will use both hands to seal the remaining fingers of each hand will form an E for lifting both sides of the jaw into the mask. Be careful not to press too hard on the mask, which could push the jaw down and block the airway.
Now it's time to practice the one rescuer bag mask technique so that in a few minutes, we can combine it with compressions to work in 2 rescuer sequence. We'll pause here to get into position. Now that we're ready, let's practice using the bag mask device. Follow along with the video. Here we go in 3, 2, 1. Give 2 breaths. Watch for chest rise. Give 2 breaths.
The most important thing with this part is to get a good seal. If you're ever like in a cold and your person, you're gonna be the one with the bag mask. Whenever you get that good seal, just stay in place. Because it's hard to get a good seal. So I'm gonna raise the nose, cup it around. Chin lift. And watch for the chest rise. Y'all want to practice? Come on, my handy helpers. And it probably is best to for 2 people to do it. So we can all practice with 2 people. One person will get the seal and the other person have to get the toy. I know it. Okay. What's your practice? Okay.
stretch real quick.
I don't know. So, give 2 breaths. Okay, that's right. Okay. Then we can swap roles. Put this back on there, right? That part,
You
yeah.
start with the breaths with that thing.
Mm-hmm.
Your hands get tired of squeezing.
But this. Okay, 2 breaths. Kathy, give 2 breaths. Well, I do the breaths, I'm sorry.
I was going to say.
Yeah.
See, I can't do this one.
You want me to turn it, we can turn it down. Okay, perfect. 2 breaths. All right, okay, so next part is mouth to mouth, which is, optional. AHA just teaches both ways. We don't have to practice it mouth to mouth, we just watch the video. So we get a break out of the floor. But just in case you're out in the community, if you don't have like that equipment, a bag mask, which you probably won't, or you might have a lab, but just in case you're out in the community and you prefer to do mouth to mouth, then this is how we do it.
Let's move into special considerations. In this lesson, we focus on mouth-to-mouth breaths, rescue breathing, breaths with an advanced airway, opioid-associated life-threatening emergencies, and maternal cardiac arrest. This section shows how to give mouth-to-mouth breaths when a barrier device isn't available.
Mouth-to-mouth breathing is a quick and effective way to provide oxygen to a victim. Each breath you take contains about 21% oxygen. When you provide a rescue breath, that breath contains about 17% oxygen. This is why rescue breaths are effective.
Start by holding the person's airway open with a head tilt chin lift. With your hand on the forehead, use your thumb and index finger to pinch the nose closed.
Now, take a regular breath and seal your lips around the person's mouth, creating an airtight seal. Give 1 breath, blowing for about 1 second. Watch your eyes as you give the breath. If the chest doesn't rise, repeat the head tilt chin lift. Give a second breath, blowing for 1 second while watching for the chest to rise. If you can't ventilate the person just until you make the person's chest rise.
Today, we've looked mostly at the procedures you should perform when someone does not have a pulse. But you should also know what to do if someone has a pulse but is not breathing effectively. When that happens, rescuers should give breaths without chest compressions. This is known as rescue breathing. For adults, give 1 rescue breath every 6 seconds. Also, give each breath over 1 second and make sure that each breath results in visible chest rise. During rescue breathing, you should also check the person's pulse about every 2 minutes. 3, 2, 1.
Oh, this is rescue.
Give 1 breath. 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 Give 1 breath.
So that is rescue breathing if the person has a pulse but is not breathing. So then you would just give them one breath every 6 seconds. And this one is a person has an advanced airway, which is a trait. If they have that trait with their breathing, which is also we're going to do. Let me see. They'll tell us what we do. If they got a trait.
Another way to deliver breaths is with an advanced airway. Devices such as laryngeal mask airways, supraglottic airway devices, and endotracheal tubes are types of advanced airways that are more secure for providing breaths. These devices help prevent gastric inflation and airway obstruction. Placing these devices requires special training that we won't cover in this course, but you should know how to give breaths when an advanced airway is in place. When you provide CPR to someone with an advanced airway, the ratio of compressions to breaths changes. Instead of providing 30 compressions in 2 breaths, you'll perform continual compressions at a rate of 100 to 120 per minute, while another rescuer gives rescue breaths. In other words, when an advanced airway is in place, you won't pause compressions to give breaths. This goes for victims of all ages, and not pausing compressions allows blood flow to the heart and brain to remain high.
An opioid-associated life-threatening emergency is one condition that might weaken or stop a person's breathing while they still have a pulse. Opioids are medications used primarily for pain relief. In high doses, these medications can cause a person to stop breathing or can even cause death. Naloxone is a medication that can reverse the effects of opioids and may restore normal breathing. Common ways to give naloxone are intravenous, intramuscular, and intranasal. If you suspect an opioid-associated life-threatening emergency in an adult who is unresponsive and isn't breathing normally but has a pulse, you should give 1 rescue breath every 6 seconds. Then, if your local protocol allows, give naloxone, but do not delay breaths to give naloxone. If the person does not have a pulse, you may give naloxone after starting CPR, but do not delay compressions. For further information on opioid-associated life-threatening emergencies, please consult your provider manual.
Handling the visible anatomy of a pregnant woman. The best outcome for both the mother and the baby depends on BLS rescuers summoning help, providing high-quality CPR, and using an AED without delay. Compressions, ventilation, and AED use are mostly unchanged. If the abdomen is visibly rounded,
Okay, if it's a pregnant woman and it's 2 of y'all, somebody just hold her stomach to the left side. It increases the blood flow and helps the baby survive. So next is how to form this team. This is if you're in a cold in a hospital. We won't practice team dynamics, but we'll watch this part just in case you're ever in a cold.
what you are about to see will include the portrayal of advanced life support skills. As a BLS provider, you may be on a team with advanced life support providers, but rest assured, those skills are not part of this training. However, no matter the skill, procedure, or equipment used in a resuscitation event, BLS must continue.
Successful teams not only have medical expertise and mastery of resuscitation skills, but they also practice good communication skills and adhere to the key elements of effective team dynamics. Team dynamics is an element of high-performance teams and can be broken down into 3 categories: roles and responsibilities, what to communicate, and how to communicate.
Clear roles and responsibilities should be immediately established by the team leader or the first rescuer on the scene. When all team members know their roles and responsibilities during a resuscitation attempt, the team functions smoothly.
The ideal situation is when multiple rescuers work as a team to perform all the needed roles in a resuscitation attempt. This figure identifies 6 possible team roles for a resuscitation. Note that some roles are typically performed by advanced providers. If enough rescuers are present, each rescuer takes a role. If the team has fewer than 6 rescuers, some team members may be assigned more than one role. Some roles have a higher priority than others.
The compressor assesses the victim and stays next to the victim's chest to perform chest compressions. When giving compressions, rescuers should switch compressors after every 5 cycles of CPR, about every 2 minutes, or sooner if tired.
The rescuer positioned by the victim's head maintains an open airway and delivers breaths while watching for chest rise and avoiding excessive ventilation.
The team member operating the AED or the monitor defibrillator can also serve as the CPR coach. The role of the CPR coach is to focus on team members' performance of high-quality CPR and to provide feedback as needed during the resuscitation attempt.
Every resuscitation team must have a defined leader who assigns roles and makes treatment decisions. Often, the team leader will be at the foot of the victim. However, the team leader may move around to observe and evaluate the skills of the team and to provide feedback when needed.
The timer recorder keeps a record of the events that occur, including frequency and duration of interruptions in chest compressions, time of shock delivery, and medication administration. When only 2 rescuers are present, they typically take the roles of compressor and airway, with one of them also covering monitor defibrillator and team leader. If 3 rescuers are present, they take positions around the victim in the 3 critical roles: compressor, airway, and monitor defibrillator.
Every member of the team should know his or her limitations. Team members should ask for assistance and advice early, not when the situation deteriorates.
I'm getting pretty tired of these compressions. I'm gonna need some help after this.
Sometimes a team member or the team leader may need to correct actions that are incorrect or inappropriate. It's important to be tactful, especially if you need to correct a colleague before they make a mistake.
The next category is what to communicate. Knowledge sharing and summarizing information are critical components of effective team performance. Team leaders should review what's happened and ask for ideas and observations from team members.
That's our second shock. We have 1 milligram of FeNO1.
Okay, starting in another 2 minutes.
About lidocaine.
Okay, 100 milligrams of lidocaine.
The last category is how to communicate. Closed-loop communication is the process of verifying that the message sent was received as intended. It also verifies that any assigned tasks have been completed.
This is our first round of CPR. We have 1 shock on board.
Got 1 shock on board.
In addition to using closed-loop communication, teams should use clear messaging to help prevent misunderstandings. Teams that work together frequently can create terms or phrases that have specific meaning for them to ensure clarity among members.
So when I'm ready to intubate, what I want you to do is pull that mask off, but keep it handy in case I happen to miss.
Finally, teams need to communicate with respect. Speak to each other in a professional manner, regardless of scope of practice or expertise. Resuscitation events are stressful and emotions can run high. Understand that this is the nature of CPR and remain focused on the life you're trying to save.
If you're ever in a code and you're in the hospital, once you call that code, you might be in there by yourself initially, but probably within 2 minutes, you're gonna have so many people in there and everybody's gonna know their role. Some hospitals or facilities have a code team. So when that code team comes, they know exactly what they come to do, whether it's a recorder that's writing everything. It's usually gonna be your doctor, nurse practitioner that's calling the code, telling you what to do, start compressions, stop compressions, give this medicine, whatever. And then you're, like we were doing, the person that's giving the compressions and the person that's giving the breaths, they know every 2 minutes to swap roles, because if not, that person giving the compressions is probably, notice that they're getting tired, you can kind of just bump them on and say, hey, I know.
Increase in CCF and defibrillation. We'll address some best practices for eliminating pauses in some of these areas, but you'll also need to measure high quality CPR metrics at your own place of practice to identify other areas where pauses. You cannot improve what you do not measure.
Whenever compressions are paused, compressors should hover their hands over the chest
Later, and prepare to deliver a shock about 15 seconds before pausing compressions at the end of each 2-minute cycle. When using an AED, the prompts will instruct you when to pause. For example,
Second compressor to have the same view of the team, and in particular of the AED or defibrillator. For seamless trouble, such as while delivering breaths.
Soft CPR, switch. Okay, hold on. Shocking, everybody clear, shock, go.
rate. If your AED or defibrillator doesn't have a metronome,
It's not enough to know what to do or even how to do it. To obtain the best results, your team must perform both the what and the how. But measurement is only effective if you debrief the team, set goals to improve, and practice more. Again, you cannot improve what you do not measure. For more information on how your team can implement this type of program, talk to your instructor.
Any questions about any of that, how we're going to see? This is just gonna tell you the different roles of your teams, your team leader, compressor, your airway person, the one that's gonna give the medicine, the one that's your CPR coach, and your timer report.
The ideal situation for performing BLS is having a team with multiple rescuers who can perform all needed roles.
your team will be asked to treat a cardiac arrest victim. Your instructor will read a scenario and assign a role to each of you. These roles include team leader, compressor, airway, medications, monitor defibrillator, and timer recorder. Some team members may be assigned multiple roles. This scenario will run for 10 minutes with the goal of providing high-quality CPR and enforcing the principles of highly effective teams. This exercise is purely practice and not a test. The exercise will, however, reinforce skills performance and improve the overall resuscitation provided to the patient.
To evaluate the resuscitation, your instructor will be looking for high-quality CPR, which includes compressing at least 2 inches or 5 centimeters on an adult victim at a rate of 100 to 120 per minute, allowing complete chest recoil between compressions and avoiding excessive ventilation. Another critical component of high-quality CPR is minimizing pauses in compressions, so your instructor will be measuring chest compression.
Vital to hospital discharge. Targeting a high CCF is desirable for survival outcomes. A chest compression fraction of at least 60% is recommended, and a goal of 80% is often achievable with good teamwork. At the end of the exercise, your instructor will conduct a debriefing session to determine where improvements could future attempts.
A beginner, so when we find them in the floor, send for help, send for the AED, and we'll do like 2 sets of compressions and 2 breaths. And then, that mannequin, actually, the dark skin mannequin, is an app that I got on my phone that will do all that measurement for us, so we'll do that. So, that's actually all for our adult CPR. We'll do the, measuring on that mannequin, and then we'll do child CPR. Okay, let me make sure he is set. Okay, so actually y'all can just do it together, like come in together. Do your 30 compressions and then 2 breaths, and then do the AED, and then after 2 sets, you do 30 compressions, 2 breaths, 30 compressions, 2 breaths, then y'all can actually swap up, and then the other person do 30 compressions and 2 breaths. Because we don't have enough for like a high performance team, and while we're doing that, this phone is gonna measure how well you're doing your compressions and giving your breaths. That part don't matter about the mask, who's mask is. So, I'm just gonna be sitting right here at the way, measure.
Yeah, totally. Just make us
So I guess you can just decide, y'all can decide who's gonna do the, breath first, the compressions first.
I don't know, so just go in.
Okay, you get him however you need it,
Right here, or it's going to turn here.
however
This
you
way.
need it.
So, we'll start with, like I said, I can't.
Cause I'm left-handed, I always have
Right.
the
Yes,
wrong way
it's
for
away
y'all.
from me, it's backwards for me.
So turn however you need it.
What, do you want to go first? That's the same, it don't matter, you can go ahead.
We can get the table.
I'm good.
Okay.
It's easier, the floor's easy for me, because I'm too short to be able to do
Oh, okay.
compressions.
So y'all have came from, y'all went to lunch together, you're coming back from lunch, you're at the hospital, you don't came back from lunch, and you are going back to the unit, and you find him in the floor. You've already sent for the code and the crash card, which is gonna have the AED on it. So now, you are doing the compressions. So you need to, want to get it side from right there. Right here, okay. Let me know when you're ready to start. Stay in the line, stay in the line. Stay in the line, stay in the line.
Adult patient. If the patient is a child, press the child button. Remove clothing from the patient's chest.
Stay in the line.
Remove packet and apply pads onto patient's bare skin.
Stay in the line for this now.
Apply pads as shown in the pictures. Remove packet and apply pads onto patient's bare skin. Apply pads as shown in the pictures. Press pads firmly on skin. Apply pads as shown in the picture. Press pads firmly on skin. Do not touch the patient. Analyzing heart rhythm. Do not touch the patient. Analyzing heart rhythm. Shock advised. Do not touch the patient. Everyone clear. Press the flashing shock button. Shock delivered. 20. 30. Give 2 breath.
Okay, well, you don't spend a whole lot of time.
10.
Go ahead and start.
20. 30. Give 2 breath.
Okay. In this issue.
I don't know if you find the best, you put these things on the wall.
Bang it like 10 seconds. And your volume, which is the volume of your, the air to the lungs, is also 88%. So you did pretty good. So 88% is passing. So now, let's see. You got it right here. Or even if you want to, just use your pocket mask.
Yeah, 'cause I have this thing.
interested?
Adult patient. If the patient is a child, press the child button. Remove clothing from the patient's chest. Remove packet and apply pads onto patient's bare skin. Apply pads as shown in the pictures. Remove packet and press pads firmly on skin. Press pads firmly on skin. Do not touch the patient. Analyzing heart rhythm. Everyone clear. Press the flashing shock button. Shock delivered. Begin.
Okay, so Kathy, you 95%. So you do it within less than 10 seconds as they suggest. Like the hands between your compressions and the breaths. It's 9, I'm gonna use this. Okay. 95. The breaths is I'm gonna put it say it's the mask. 85. Hands off it's 100. Okay. I will take that. Oh, okay. So that is all with adult CPR. Any questions about anything? So your 30 compressions, 2 breaths, 30 compressions. That's it. So now we are going on to child and infant CPR. So let me get these. You rolling it?
Yes, ma'am.
Okay. Or a team approach is always 30 compressions and 2 breaths. With your children and infants, it changes. If it's one person, it's 30 compressions, 2 breaths, but if it's 2 people or more people, the rate is gonna change from 30 to 2 to 15 to 2. So, but they'll talk about this in the video. This is one of the major changes. First section, we're going to talk about the pediatric chain of survival.
Pediatric cardiac arrest isn't as common as adult cardiac adults, the cause of cardiac arrest is often cardiac related, but in children and infants,
There are some differences in BLS for children, including the chains of survival. Like the adult chains of survival, the pediatric chains have 6 links. Both pediatric chains include prevention of cardiac arrest, activation of the emergency response system, high-quality CPR, advanced resuscitation, post-cardiac arrest care, and recovery. In a hospital setting, the difference is the first link. It focuses on early recognition and prevention of cardiac arrest, which emphasizes patient monitoring and assessment.
before we get to the practice, let's talk about a few important differences between BLS for children and BLS for adults. First, under the AHA BLS guidelines, anyone from age 1 year old to puberty is considered a child. Under these guidelines, puberty is defined as chest or underarm hair on boys and any breast development on girls. When you're performing compressions on a child, it's fine to use 1 or 2 hands, whichever works for you and allows you to provide deep, effective compressions.
To be effective, your compressions must go to a depth of at least 1/3 the depth of the child's chest. That's approximately 2 inches or 5 centimeters. And the chest must recoil completely between compressions. Also, whether the victim is a child or an adult, a single rescuer always uses a compression to ventilation ratio of 30 compressions to 2 breaths. However, if you're a 2 rescuer team and the victim is a child, the ratio changes and should be 15 compressions to 2 breaths.
It's important to note that giving breaths to children requires less volume and force than giving breaths to adults. Breaths that are too large or forceful have greater potential to cause lung trauma in children than in adults. However, you still need to provide enough air to see the chest rise.
Another difference is when to activate the emergency response system. If you do not witness the arrest and you're alone, you should perform 5 cycles of CPR to deliver oxygenated blood to the victim's brain before you activate the emergency response system. If the child has an adequate pulse but is not breathing normally, it may be due to a respiratory problem, so you must provide rescue breaths. Deliver 1 breath every 2 to 3 seconds or 20 to 30 breaths per minute.
If you are alone and witness a sudden arrest, leave the child so that you can activate the emergency response system and get the AED. Then return to the child to perform CPR and use the AED.
Now, let's combine the BLS skills that you've learned for adults with the differences we just reviewed to practice BLS for children. For this session, we'll practice 2 rescuer child CPR by using a 15 to 2 compression to ventilation ratio. One person will provide compressions while the other delivers breaths with a bag mask device. We'll pause here while everyone gets into position.
We'll watch this part and we'll practice.
Now that we've covered adult BLS, let's discuss BLS for children. It may be difficult to imagine a child being a victim of cardiac arrest, but it certainly happens. So let's count down to compressions and get started with 2 rescuer CPR for children, starting with scene assessment. To stay together, follow the prompts on the screen. Let's go in 3, 2, 1.
Hey, are you okay? Are you okay? Activate the emergency response and get an AED. There's no breathing, no pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Dear.